Good day everyone, hi, it's me again, May from BSN A1, and for today's video, I'll be showing you how to do the administering an intradermal injection for skin test. In administering an intradermal injection for skin test, the equipments we'll be using are the following: clean gloves, of course a alcohol for sanitizing, the ampule. It should be the correct medication ampule, alcohol prep pads, dry sterile gauze, a sterile tuberculin syringe, of course with needle and another extra needle, and of course the medication administration record of the patient. In administering medication, we must always remember the 10 rights. First is the right medication, right dose, right time, route, client education, documentation, right to refuse, right assessment, and right evaluation. So the first thing that we are going to do is to perform a hand hygiene. It's either to wash our hands or to sanitize them and observe the appropriate infection control procedures. Then, we are going to prepare the medication from a vial or ampule for drug withdrawal. In preparation, we must first check the medication sheet, check the label on the ampule carefully against the medication sheet to make sure that the correct medication is being prepared. Follow the 3 checks of administering medications. Read the label on the medication. First, when it is taken from the medication chart. Second, before withdrawing the medication. And third, after withdrawing the medication. Then, we must organize our equipments. Next, we are going to flick the upper stem of the ampule several times with a fingernail. Then, we are going to place a piece of sterile gauze between our thumb and the ampule neck. But first, we are going to clean the neck of the ampule using the alcohol prep pad. Here's the neck. And then we are going to break off the top by bending it toward us to ensure the ampule is broken away from ourselves and away from others. After breaking off the top of the ampule, we are now going to dispose the top of the ampule in the sharps container. Then, we are going to place the ampule on a flat surface and start to attach the filter needle to the syringe. We must also remember that we can only touch the plunger flange and the barrel part of the syringe. Then we are going to remove the cup of the filter needle and insert the needle into the center of the ampule. After attaching the filter needle, so we are now going, and after removing the cup from the filter needle, now we are going to withdraw the amount of drug required for the dosage. So our order says 1 ml of medication. Now we are going to dispose the filter needle by placing it in a sharps container and replace the filter needle. Tighten the cap of the hub of the needle and push solution into the needle to the prescribed amount. Next, we are going to introduce ourselves and verify the client's identity. We must also explain to the client that the medication will produce a wheal or bleb. After, we are now going to provide privacy for the client. It's either to close the door or to close the curtains. Now, we are going to select a site. So, we are going to use our 4 fingers down on the forearm, making sure that the patient's arm is flat and resting. So, for example, this is the patient's arm. It should be flat and resting. Then we are going to count 1, 2, 3, 4. So this part, this should be the selected site. This one. Okay, so as if that this is the selected site in the patient's forearm. Then the next thing that we are going to do is to cleanse the skin at the site using a firm circular motion starting at the center and windering the circle outside. Okay. Then we are going to wait until it dries. Now we are going to remove the needle cap while waiting for the antiseptic to dry. Now we are going to expel any air bubbles from the syringe. But as you can see, there is no any air bubbles in my syringe. So now we are going to grasp the syringe with our dominant hand close to the hub, holding it between our thumb and our forefinger. Then we are going to hold the needle almost parallel to the skin surface with the bevel on the needle up. Okay, so here the bevel of the needle should be up. Now we are going to insert the tip of the needle far enough to place the bevel through the epidermis into the dermis and stabilize the syringe and needle. Then we are going to inject the medication carefully and slowly so that it produces a small wheal on the skin or a blip. Then we are going to withdraw the needle quickly at the same angle at which it was inserted.